Based down in Memphis, Tennessee, you're essentially in the backyard of FedEx's Matrix shipping hub. Have you already seen vaccines come through the doors of your hospitals?
Oh, not yet. Thank you again for having me this morning. We have not seen one coming, but we are really excited. You know, this is the week we've all been waiting for, as stated earlier. Yes, with FedEx here, with their logistics and the delivery network, I'm very confident we'll be getting some soon. And again, the delivery process will go very smoothly.
Great. And Dr. Slonim, I'll put the same question to you. And actually, I will build on that, just listening to some of that commentary from Pfizer's Bourla. How will you know, as the vaccine rollout continues here, or begins and continues here, how will you know that that supply chain is working smoothly and that supplies are coming through at the rate they're supposed to?
Well, good morning, and thank you guys for having me. We are also awaiting vaccines. We have our priority list all ready to go. It is a historic moment. We're very excited that our frontline workers are going to be able to get the vaccines that they need. And as we wait the supply chains, it's kind of a wait-and-see approach as we get our allocation from the central sources.
So, Dr. Slonim, then, do you know when you're going to be or when administering the first vaccine to people on your staff?
Yes, over the course of this week, we have a more centralized approach to it. So we're using the Department of Health as a major resource to get our Tier 1 healthcare workers up and running with the vaccine this week.
And Michael, in terms of priority, given the fact that supplies are limited, at least for now, how have you decided who within your hospital system will get vaccinated first? And what does that process continue to look like over the coming months as you expect more doses to follow?
Absolutely. So we have stratified our sources, obviously starting with 1A1 category group, and those are the physicians, the frontline associates, the housekeepers, our transporters, our emergency room associates, all those that are truly on the front line of this COVID, as we call them. They are the combats in this war that we're talking about. And we are really excited that they'll be the first ones to receive it, quite frankly, because that makes them safe so they can continue to provide care to all the patients that are coming to our facility.
Dr. Slonim, all of this good news, very good news. Unfortunately, the situation on the ground that you're seeing in terms of the spread of the disease is not particularly good. Give us an update on what you're seeing in your area right now and what you're doing to meet that unfortunate demand for service from people who are sick.
Yes, the vaccine certainly is good news, and it couldn't come any sooner, for sure. We are still struggling with surges after the Thanksgiving holiday. Patients continue to be admitted to the hospital. We haven't yet seen the increases in mortality rates that usually follow. We all know the trend and the pattern here. Usually people start to get sick, the hospitalizations increase, the case rates go up, and then the mortality rate goes up. And it certainly is concerning that we're having these struggles as we approach the major Christmas and winter holidays.
Michael, similar question to you. Again, juxtaposed with obviously the ability to start administering the vaccine to your frontline workers. What are you seeing, though, in terms of patients showing up at your hospitals?
Absolutely. Over the last several weeks, it's been very high. In fact, we're averaging close to 200 cases now every day since the late November. And that number is increasing. Obviously, it's a concern that we've all expressed, knowing that there will be an impact following the Thanksgiving celebration over the last several weeks. So with the vaccine, obviously, available today, we're excited about that, the potential that it holds for containing this virus. But what worries me, to be very candid, is people letting their guards down, because this, again, we have still some time before everybody in this country will get this vaccine. So it's extremely important to realize that it's still not over, even with the shipment of the vaccine starting today.
Shepard Smith here. Thanks for watching CNBC on YouTube.